Hi everyone, myself Salvina. Welcome to Nursing Guru. Today I came with another topic, that is the psychiatric disorder. Today I came with another topic, the psychiatric disorder. In psychiatric disorder, like depression will come. I will tell regarding depression, what is depression. Depression is a low mood and loss of interest in inactive that affected the individual thoughts, behavior, feelings and physical well-being. In depression, some type is there. What is that? In this, like first will come atypical depression, catatonic depressions, and another one is postpartum depressions. In depression, some signs and symptoms is there. When the man will get or human will get the depression, the symptoms will come one by one. What is that? Lack of sleep pattern, depression mood. So now I am going to tell about what are the signs and symptoms is there in depressions. Actually, when the people are getting depression's mood or depression's disease condition, that time it will happen. So it will happen like a person will get the depressive mood, lack of pleasure, lack of interest to talk with another people, and weight loss, everything. So I am going to tell another disease condition which is called the delirium. Delirium is a main psychiatric problem in human. Okay, what is that? In this, the delirium is the organic brain syndrome with the impaired consciousness and delirium significant acute cerebral insufficient. It's called the delirium. In this, the emergency cases, the psychopathy or psychoanalytic will come. The different thought will come. It's called the delirium. So now I am going to tell another one, another psychiatric disorder, that is hallucination, like organic hallucinations. What is that? Organic hallucinations is the most common hallucinations in human body or human like people. So what is that? It is a disorder of persistence or recurrent hallucination, usually visual or auditory. That absence of significant intellectually decline and promotion of the disturbance of moods and predominances of direction. So now I am moving to the another disease conditions. What is that? In this, that acute mania will come. What is that in acute mania? In this, the high level of stress, lack of sleeps or patients are an antidepressant and many overshoots in acute. So it is characterized by the sudden evented or irritable mood. So when the people will get the acute mania, that time people having the irritation mood. Hey guys, so I completed all the psychiatric disorder topic. If you people having any doubt on this, so you can comment in comment section and like, subscribe and share it. Thank you.